In neurodegenerative diseases, we see death of neurons, of nerve cells, that result in a breakdown, in a dysfunction of the brain. Neurodegenerative disorders are disorders that present oftentimes with slowly progressive symptoms: cognitive dysfunction, abnormal movements, difficulty walking, difficulty talking, difficulty speaking. Unfortunately, though, oftentimes when a patient presents with symptoms that we can diagnose, it's oftentimes late in the course of their illness. We really need to be identifying these diseases earlier in the phase of their illness. We need to figure out ways of trying to help regenerate those circuits, rather than just acting to treat the disease with symptom therapies. We need to get at the underlying etiology of these disorders. The field of neuroelectronics is really arrived, and now Mayo Clinic, through the Bionic Program, is bringing together the expertise of neurosurgeons, functional neurosurgeons, bioengineers, neurologists, our data scientists, our AI experts, all coming together to really think about how to help patients with these neurodegenerative processes. How can we, using bioelectronics, how can we help patients to get better? We now know that patients that have Parkinson's disease, where they have, for example, severe tremors down one side or significant difficulties with their gait or walking, we can now put in implantable electrodes in the brain, provide electrical stimulation that will result in marked improvement in the patient's symptoms. So the opportunities now are that with, for example, electrical stimulation, whether it be from an implantable device or from a non-invasive device, these potentially can help repair some of these circuits so that you can improve not only cognition, but also potentially improve the movement, reduce the tremor, improve the patient's gait, the patient's safety, and ultimately the patient's quality of life. The opportunities for the bioelectronics to impact epilepsy, sleep disorders, movement disorders, brain tumors, stroke, cognitive disorders is dramatic. And we recognized that the next decade with respect to neurology is really going to be impacted by the field of both invasive and non-invasive neuroelectronics. The future is bright for patients with a variety of different movement disorders. We know in the context of Parkinson's disease that implantable electrodes with the correct stimulation, the correct oversight, can really improve patients' lives. But we need to be pushing the envelope further. So the thrill of Bionic is that we want to have an opportunity, a playground, where we can start to look at all of the different modalities, all of the different treatment options. We need to be thinking of patients as individuals and applying individualized approaches to their therapy.